Hi, this is Dr. Reed with Family Doctor in Kapolei, and today I just want to continue the series on diabetes. And so far we've spoken about how the body deals with sugar and how that gets disrupted in the diabetes type 2. I just want to talk today about some of the complications of diabetes. What are the consequences of it? One of the problems with this disease is that when I diagnose somebody with diabetes type 2, they kind of thinking to themselves, I don't know what you're talking about, doc. I feel fine. I don't know why I have to take all of these medicines. I don't have any symptoms. And most of the time, that's true. Most people initially diagnosed with diabetes don't have symptoms. Now, some do. Some people have what we call polydipsia and polyuria, which means they're thirsty all the time and they go into the bathroom all the time. And it seems like no matter how much they drink, they just lose it all right away. And one of the tragedies is quite often instead of just drinking water, they're drinking soda full of sugar, and that's just making the situation worse. And that's some people, and they'll notice immediately once they start taking the medicines that goes away. And some people, it's so bad that they lose a lot of weight because they lost so much water. And then they start to regain that weight again, which is just water, but it's water that they need. So there are some very important consequences, though, with diabetes in people that don't have any symptoms. The sugar is not innocuous. The elevated sugar in the blood is very damaging, particularly to the blood vessels. And the blood vessels, the inside surface of the blood vessel gets damaged, and then the blood vessel cannot carry the blood as well or to the places that it used to. And I think I'm going to deal with this on a subsequent session. I'm going to talk about the various, there's important side effects to do with the eyes. There's important side effects to do with the legs and the feet. There's important side effects or consequences or complications to do with the heart and to do with the brain and to do with the nerves and so on. So we'll talk about that next session. But in the meantime, what can you do? If you're experiencing this polydipsia, polyuria, then you need to go and see your doctor and find out, is there something wrong? Do I have the diabetes? Basically, the feeling is that you're thirsty all the time, but then you're going to the bathroom all the time. And that needs to be looked at. Now, if that's you, don't drink the soda, drink water, and go and see your doctor as soon as you can. If you're not at that point, then make sure you're getting plenty of cardio, plenty of exercise, and you're observing a healthy diet. And that's the best way to avoid getting diabetes. And we'll pick this up on our next session.